Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobby Bagley, Chief Public Health Official and Director for our Division of Public Health and Community Services. And I'm here to give this short segment introducing our Health Promotion and Communication Specialist, Sarah Aissis. Now, as the Health Promotion and Communication Specialist, because this is your first time being in front of the camera, Sarah, tell us a little bit about your role as our Health Promotion and Communication Specialist, and why is that such an important role in public health?
Absolutely. So a lot of what I do, and this is how I like to explain it to people, is outward facing. So things that you see come out of the division, whether that be educational materials like brochures, event flyers, billboard ads, social media information, the weekly newsletter. I handle all of that. I do our marketing and I do our communication. So anything that gets pushed out to the public is me on the back end. A core function of public health is communication, right? It's hard to have a healthy community if you're not actively providing education for the community so that they know what's going on within their environment, so that they understand if there's any kind of outbreak. What does that outbreak look like? What are signs and symptoms of what's going around? How concerned should I be? And if any treatments come out, okay, is this the right treatment for me? What does this look like? What conversations should I be having with my doctor? What are those risk factors? It's a lot of that educational portion for our community so that they can make the best informed decision for their own health and their health journey. So I take that very, very personally, and I feel very grateful that I'm in a position where I'm able to help our community decide how they are best able to protect their own health. So I do a lot of that background work. And again, whether that's pushing out simple education to the community in a way that they can understand, putting out ads and graphics that might resonate with individuals so that they understand the health information coming out, or putting together brochures that they can take home and kind of digest on their own time and maybe bring back to their PCP and have further conversations if something seems right for them. That's a lot of what I do. I'm very much used to being the person in the background behind the screen.
Yes.
So yeah.
Yeah, well, now you're going to be out front.
I'm out front.
And, it's really important there. I think there are key positions that are really important in public health because communication, education, and awareness is a part of that primary prevention toolkit that we use. As you said, in order for individuals to make informed decisions, they have to get the information, right? And so another key role that you play as a division is making sure that we dispel myths, and that we correct disinformation and misinformation. Yes. So do you want to talk a little bit about that in your role as well?
Yes. So within my role, so there are three terms I'm going to kind of use here that I want to just jump into a little bit. There is misinformation, disinformation, and malinformation. And over the past few years, we've been definitely seeing a lot of these three things in many different capacities. So misinformation is when incorrect information is being spread around, whether or not an individual is aware that that information is incorrect. Disinformation is when somebody knows that they are spreading incorrect information for whatever reason, but they're aware that the information that they're spreading around is not accurate. Malinformation is spreading incorrect information with ill intent that can cause injury or illness to individuals. So a lot of what I do on the back end is keeping an eye on social media, on news reports, anything that's coming out to the public, and that can include comments on social media posts of maybe some health information and somebody said something that's maybe not so accurate about a vaccine. And I'm going to use that example because that's what we typically see the most, vaccine misinformation. So taking that opportunity to respectfully address that comment and give the correct information. We don't know where that person may have gotten the information. We don't know how they might be coming at it. And we want to make sure that we're responding respectfully, because all we want to do is just educate respectfully to our community members, and just say, this is the correct information. It is scientifically backed up. Here are some resources where you can learn more about this, and really try and help them to understand where this information is coming from and how it adds up into what we are communicating with them.
Yes.
Yeah. So that's, yeah.
Yeah, and very important roles. And now that we have AI, artificial intelligence,
Yes.
that's going to present as another challenge. A lot of people are using AI for a lot of different things, to acquire and get information. What are your thoughts on that? And I know, even for myself, I looked something up using AI. I looked it up a little bit later, and the information changed. The dates changed, wrong for different names.
Yeah.
So what are your thoughts about that, for people that want information? Because the work that we do is complex.
Yes.
The information that we provide, we try to take complex information and we try to put it in bits so that people can understand it. What are your comments with regards to a person using AI to try to understand some of the nuances of public health things, even with vaccines in about like 30 seconds? How would you,
Yes.
what is your thought on AI?
AI is an extremely powerful tool that can help individuals get a better understanding of, health literacy, education, topics that are maybe challenging to digest, especially when you get into the legislative field. Oh my goodness, that language is super complex and hard to understand. So it is a great resource for turning to and asking, can you help me understand this? Can you break it down? One of the things I do want to raise awareness is, though, with AI, it will uphold bias, right? And there isn't a lot of fact checking as well with AI. So you have to make sure when utilizing AI, if it's giving you facts, I always like to put in, where did you get this information from? Because a lot of the times it has come back and said, it's great that you checked that. We don't know where we got this information, right? So we want to make sure that we're fact checking AI, and also making sure that we're not unintentionally consuming information with a bias. So we want to say, can you give me this in an unbiased perspective using evidence-based information and reliable sources? That way we're getting that information that is trustworthy and backed by science.
And that's how we work in public health.
That's how we work in public health.
Sarah, thank you so much for being here today, for helping us kick off National Public Health Week. I'm Bobby Bagley, and I'm reminding you to have a great day today and a better day tomorrow. I'll see you next time on Public Health Matters.